new national data shows more kids and young adults are turning to popular weight loss drugs like Wegovy. But what does this mean for families here in North Carolina? WRAL health reporter Grace Haba joining us now. Wondering, Grace, why is it that we're seeing these numbers start to rise now?
Well, the biggest factor, Dan, really just boils down to popularity. I think we've all seen these ads for these GLP-1 injections on our phones, social media, walking down the street. And now we've seen more insurance companies, too, get on board with coverage. So all of that, in turn, has resulted in a younger population, according to new national data, more of them taking this medication. So take a look at this chart. The Evernorth Research Institute found that between 2023 and 2024, weight loss drug use in Gen Alpha, which are those kids aged 14 and younger, increased by 85%. Gen Z, those are kids between 15 and young adults through 28 years old, that was a 68% increase. And you compare that to millennial adults, which are 29-year-olds to 43-year-olds, who showed a 48% increase. So you can see the popularity in these medications. However, here in the Triangle, UNC weight management physician Dr. Jennifer McCauley shared the trend hasn't quite hit us yet full speed.
For adolescents, we're more likely to target treatment therapies based on if there are other risk factors such as diabetes, prediabetes, or fatty liver. If we're seeing that we're already seeing downstream effects of weight, we're going to be more likely to want to treat with a medication such as a GLP-1.
The doctor also shared she does think our area will start to see more younger patients on these types of medications with more time. McCauley also adds that anyone taking GLP-1s really needs to fit in lifting weights along to their schedule because these medications have been shown to reduce muscle mass, which she says could potentially make children in particular more likely to develop osteoporosis in the future. And she also adds adolescents need to be having follow-up appointments with their doctor to monitor these side effects because, as we know, Grace, long-term effects of these drugs really just haven't been studied yet.